1 month from tomorrow, it is Election Day, and one item on the ballot that is being talked about and will bring voters to the polls, Prop 2, the voter initiative to expand Medicaid in Idaho. Tonight, our Joe Paris verifies the claims made on a new ad in support of Proposition 2.
A new Prop 2 ad paid for by Idahoans for health care argues that the expansion of Medicaid would bring money back to Idaho, expand health care, and create jobs. But would it? We verified.
Every year, $400 million of our tax dollars go to Washington, D.C. And every year, Washington sends those dollars to other states. Your tax dollars to pay for their health care.
The federal government collects taxes from every state and then uses that money to pay for federal programs. One of those programs is Medicaid, which has not been expanded in Idaho. The states that have extended Medicaid coverage do get extra federal funds for the program, but they are not specifically getting Idaho's money. The Congressional Research Center clarified this in 2015, saying, quote, if a state doesn't implement the ACA Medicaid expansion, the federal funds that would have been used for the state's expansion are not being sent to another state. There is not a set amount of federal funding for Medicaid. Each state gets the federal funding necessary for their Medicaid program. So we can verify that Idaho would get more of its tax dollars back if Prop 2 is passed, but other states have not been getting Idaho's money for Medicaid programs just because the Gem State hasn't opted in.
But there's an Idaho solution that would change that. Proposition 2. It would bring our tax dollars back to Idaho.
According to a report for the Idaho Department of Health and Welfare done by Milliman, Inc., in the first full year of Medicaid expansion, Idaho would get around $370 million extra in federal funding for Medicaid.
And expand Medicaid to tens of thousands of hardworking Idahoans.
We can verify that yes, the expansion of Medicaid would open up health insurance to the about 75,000 people that fall into the so-called coverage gap. Those are people who currently make too much money to qualify for Medicaid, but too little to qualify for health care subsidies.
Help our rural hospitals, create jobs, and bring our tax dollars back.
According to a report done by Georgetown University, the expansion of Medicaid could help improve the quality and availability of health care in rural areas and small towns. And Idaho is mentioned by name in that study. According to it, fewer uninsured people would typically translate to a more stable health care system. In addition, the report says that Medicaid expansion would save rural hospitals money by cutting down on the amount of unpaid bills from people who can't afford treatment. In terms of creating jobs, this ad cites a private consultation report done by Stephen Peterson, a clinical associate professor of economics at the University of Idaho. According to Peterson's study and explanation, federal dollars supporting Medicaid expansion would represent, quote, new monies coming into Idaho's economy, which he says creates economic activity, supporting new jobs, new spending by individuals and organizations, and new tax revenue. That claim, though, is tough to verify since it is based on economic projections, but it could very well happen.
We also reached out to the opponents of Prop 2 for a comment on the new ad. A spokesperson for the Idaho Freedom Foundation said in part, quote, simply put, Idahoans' money isn't being spent by other states because Idaho didn't expand Obamacare. Whenever a new state expands Medicaid, the money comes from debt spending, not states that didn't expand. It goes on to say the supporters of Prop 2 have built their whole ad campaign on a lie. Every state that expands Obamacare does so by adding to the national debt, end quote.